Hello, everybody. I am Dr. Dan Kalish, and I am here today to speak with you about H. pylori, which is my absolute favorite subject because it is the single easiest thing to identify which will change your patient's lives. And if you are not, let me repeat, if you are not testing every single patient for H. pylori, you are not doing functional medicine. Just coming out and saying it boldly. Thank you, Genova Diagnostics, for helping to put this on. They have become, over the past many years, one of our greatest partners in education and really appreciate their support very much and their ability to run a lab company with such precision and elegance and wonderful reports. They've been around longer than I have. I've been in practice for 31 years, and so got to really appreciate these institutions like Genova that have been here for functional medicine practitioners decade after decade. And so let's get into it. There's not a whole lot to mess around with. This is a couple of things to talk about. We had a huge number of people sign up for this class. So I'm thinking many, if not most of you, are new to us at the Kalish Institute. So I'll introduce myself briefly. I am Dan Kalish. I've been in practice since 1990s. Let's just say the early 90s to leave it a little ambiguous. I've been involved in a lot of different projects. In fact, we did a project with the Mayo Clinic 2016. We published a paper where 8 out of the 9 H. pylori cases that we detected, we resolved with the herbal programs that I teach in the various courses at the Kalish Institute. And that was sort of groundbreaking and an important study. And I've been working with Dr. Richard Lord, who's one of the innovators that created the test that we'll look at later on in the session called the GI-FX test. Richard's long been retired, but he and I have worked together and continue to work together on developing lab interpretation curriculum, developing my lab interpretation skills so I can share them with you. And we're super excited to have all the resources around that we do. We teach a lot. We have a great class coming up with Genova called Interpreting the Genova GIFX Protocols That Work. If you have any interest in GI, you should take this class. You get $400 off if you scan that QR code there and just sign up, take the class. These are great ways to spend your summer, kind of honing your skill set in terms of interpreting the GIFX. And it's a massive test full of data that's amazingly complex to interpret. So you need to have some training in this. It's not something you can just pick up and look at and read the report and understand what's going on. Not by any means. In fact, I spent at least 2.5 years, twice a week, for 3 hours each session, working with Richard Lord, with him explaining to me every single marker on this test, just to give you an idea of, I don't know, you could add up the number of hours. It was a lot of time. It was a couple years of my life to learn how to interpret this test with a man that developed it, and ran the test and ran the lab for decades, for like 40 years. So there's a lot here, and we're just going to scratch the surface today. But the goal of today is just to get you to test. We had a new student in my mentorship program that I just spoke with this week, and she's the doctor, practitioner in the class, and um, her own kid had H. pylori for 5 years. Okay, nausea, vomiting, all kinds of symptoms, and it was just missed. So this is not just for adults. We want you to test anybody over the age of 2 years old. I don't work with infants, but anyone over the age of 2. Certainly you want to test all your kids, 8, 10, 12, 15-year-olds. And you would be shocked how common this problem is, and you would be shocked by the amount of tissue damage and inflammation that this infection can cause. The hardest thing to understand about H. pylori is that most of the time, the GI symptoms are gone. They had the GI symptoms a long time ago, but they're gone. And so you'll have a typical patient, let's say this just happened last year. When did your problems first start? I'm asking the patient, when did your problems first start? And like, I don't know. It feels like I've been depressed and tired forever. Can you really go back to a time when things were better? It's like, well, yeah, in college, things were going pretty well. That was like 10 years ago. Did anything happen? And eventually after an hour of talking to somebody, you figure out, well, gosh, You got really sick at this restaurant when you were in college and you were out, for a couple of weeks, and then you seem to recover. And then ever since then, the depression and anxiety has gotten worse and worse. You run a test, they have H. pylori. So just because they have current symptoms that have nothing to do with GI does not mean they don't have H. pylori. So most current patients that I have that have H. pylori have symptoms like fatigue and anxiety and depression. Not necessarily things that you would associate with a GI problem, but chronic inflammation in the GI tract from an H. pylori infection will cause fatigue, depression, and anxiety, female hormone imbalances, you name it, insulin resistance, anything that you can associate with inflammation can be triggered by an H. pylori infection. And that includes prediabetes and diabetes and cardiovascular disease. The list is pretty long, autoimmunity, all those things. So you can have some cases that are obvious, like nausea and vomiting every day for 5 years. Obviously, you should check for H. pylori. But we want to get you beyond that and to understand that in functional medicine, we don't run labs based on symptoms. We run the microbiome or GI testing on everybody because every patient that you have, hopefully, has a microbiome. And you got to know the status of it, regardless of what their symptoms are. And if you follow that general rule and you just check everyone's microbiome, you'll be able to solve these H. pylori infections left and right, and you'll be getting thousands of cases of people better, just like I have in my own practice. Another aspect of H. pylori, which is not talked about enough, is that chronic H. pylori infections interfere with the stomach's ability to break down protein and amino acids. And so a lot of times you'll get downstream effects of H. pylori infection being, inability to build things because you don't have enough amino acids because you're not absorbing very well. So some kind of malabsorption syndrome. And I have a couple of examples. So I'm going to go through some slides now, and then we have a couple of sample labs that I want to interpret, and then we can do questions. So it's not that complicated. You run the lab. What lab, you ask? Well, let's just cut to that just for a second. You run the GI effects test and make sure that you have the H. pylori as an add-on. So you go to your Genova account, you get into your portal, or you call them, whatever you do. I was going to say you fax them, but that dates me. You're not going to fax them. Nobody uses faxes anymore. But you're going to, get into the portal. You're going to order a GI effects test, and you're going to add H. pylori to it, and then you're going to run that, and then you're going to move on. Okay, so that's the test, GI effects. But you got to do the add-on of the H. pylori. It's an extra couple of bucks. It's not a big deal money-wise. So the most common failures that we see, so let me back a slide here. So you just need to run the test. Once you find the bug, then there's a protocol for fixing it. And the temptation in the beginning is to go after the H. pylori because you see it there. Okay, but this is not like a kitchen fire. If your stove caught on fire, you're not thinking about, anything else except for getting a fire extinguisher and putting it out. Okay, that's not the situation here. If H. pylori is present, you don't want to just jump in and try to fix it. You got to be strategic and think it through and think, okay, how long has this person had the infection? I want to upregulate this person's immune system first through diet and lifestyle changes. I want to strengthen their secretory IgA first through adrenal support and supporting cortisol. And when they're healthy and I feel like the person's getting a little bit better a couple months into their program, then we're going to kill the bugs. The biggest mistake that people make is that they try to kill the H. pylori too early in the program, and then it doesn't work because you don't have the strength of the immune system behind you. Another way of saying that, I could say it in the reverse, is the reason why people have H. pylori in the first place is because their immune system is shot. The reason why they're having this problem is underlying problem is that their immune system is not doing well and their microbiome is weak. So you want to strengthen the system first and then kill the bug. You can't just kill the bug and then strengthen the system because you do that, the bug's just gonna come back or you're not gonna even get it in the first place because you need the body's immune response on your side in this. So everyone wants to treat GI first, I get that, but it's lifestyle first. Diet, exercise, meditation, sleep. In my mind, lifestyle includes an adrenal panel and fixing cortisol. You get a couple months of that going, and then you're going to be able to get rid of H. pylori very consistently. In fact, on the Mayo Clinic study that I mentioned earlier, 8 out of 9 times, we cleared the H. pylori, and we used herbs with everybody. We didn't even use the antibiotics at all. So hey, you can get this thing almost all the time. If we had used herbs and antibiotics, it would have probably been 9 out of 9. So, and then the other common failure I mentioned earlier is that we're not doing this based on GI symptoms. H. pylori symptom, the main H. pylori symptom that I see is fatigue, depression, anxiety, probably those three. A common H. pylori symptom that I have seen this week in my own practice is autoimmune problems. Another common symptom of H. pylori, and I saw this last week in one of the classes I taught, is an eating disorder. Someone who's throwing up all the time, not because they're bulimic, but because they have an H. pylori infection. So it manifests in many, many different ways. The obvious stuff is gas, bloating, acid reflux, and all that. We're kind of assuming that you're screening everybody with the GI effects that have those symptoms, but we want you to also test people that have all these other issues like anxiety, etc. So in terms of why this is so confusing when you're interviewing a patient, it's because patients relate to these clusters of symptoms, not to what's actually driving the problem. And the patients in general are just dealing with the symptoms that they're having right now. And it's not so common in a chronic health problem that your current symptoms are going to tell you exactly what the original cause is of the problem. If that was the case, then we wouldn't even probably have jobs, right? Because people would figure this out. The problem is that you have the H. pylori, and then 12 years later, some symptoms happen, and the patient doesn't associate the two together. And so that's why we screen everybody for these tests, because if you try to figure it out from a symptomatic perspective, you'll just be flummoxed and perplexed. So the two most important questions to ask every patient is when did this problem first start? And what else was going on around that time? So when did this problem first start? Okay, the anxiety and depression, 12 years ago. Okay, let's talk about that. Okay, so you ate at a restaurant in Seattle and you got really sick around that time. I'm talking, this is like, it can take 45 minutes or an hour to figure all this out, but you want to go back in time as much as you can, asking those two important questions. When did this problem first start, or how long has this problem been going on? And what else was going on in your life around that time? Okay, those are the key questions. And you'll almost always find it happened 5, 10, 12 years ago originally, and that they were under a lot of stress when it occurred. It's almost always going to be the case. And so if we're identifying the stress as being the weakening factor, the weakening of the immune system, right? And then that's what allows the H. pylori to get a foothold and cause problems, then we want to treat the stress through lifestyle, diet, exercise, sleep, meditation, spiritual practices, and then kill the bugs. I love killing H. pylori. There's nothing more satisfying than taking this bug out. I mean, really, it's just, if you ever seen like a John Woo movie or the John Wick movies, it's like when all the bad guys are lined up and they all get, shot with one machine gun. It's just very satisfying to get rid of this bug, and it changes people's lives. But you just need to plan ahead and not aggressively treat it until the patient's completely ready. So there are, of course, a whole cascade of GI symptoms that are related to H. pylori, and nausea, gas, constipation, or diarrhea, or alternating that. Obviously, heartburn, reflux, gastritis, all these different things, upper GI pain and discomfort. Okay, those are kind of obvious ones, but we want you to start thinking about the less obvious ones as well. And so H. pylori causes damage to the stomach lining and reduces stomach acid production. Common in people that have heartburn and GERD and bloating, especially if it happens right after they eat. But the key is that it causes damage to the stomach lining. And as it reduces stomach acid production, as I mentioned earlier, that reduces our ability to absorb and break down and absorb amino acids. And that starts to cause a whole host of other problems. Okay. You can get it from food, you can get it from kissing someone else who has it, which makes you really want to think about who you're kissing out there, and you should be doing that anyways, probably. But in a balanced microbiome, in a healthy microbiome, in a patient without a huge amount of stress, H. pylori can be considered by some people to be actually protective or at least neutral, like a commensal. So this is a single organism. It's the same, organism that can either be a severe pathogen, can be neutral, or can be protective. How can that be? How can the research show that? It's like when they were first doing quantum physics and they were like, oh, we're going to find this, photon, electron, what is it, proton thing. It's like, it's a wave. And then they're like, wait a minute, no, it's a particle. But wait a minute, depending on how we look at it, it's either a wave or a particle at the same time, but it's like that. Okay, H. pylori can be a pathogen that's destructive, but it can be protective or neutral. How is that possible? Because it's the person's immune system that determines what's happening. If your immune system is not doing well and you're stressed out, H. pylori becomes problematic. In fact, we had a case this morning in the mentorship class in the 1-year program that I teach, where there's a new patient, the doctor was presenting the lab, and the patient had a perfect microbiome, which is pretty rare. It's like, okay, this person eats just beautifully, just eating healthy farm fresh food, and they had a little bit of H. pylori, but it wasn't causing a problem. If you have a balanced microbiome, all the things that we're talking about today don't really matter. But how many people have a healthy microbiome? None of your patients do, I'm sure they don't. Maybe 1 out of 100 or something. You can also have H. pylori, and we'll show some examples of this when we get to the labs in a minute, and other infections. What do you know about that? That's crazy. In fact, there's one infection that's super common with H. pylori, which is called blastocystis hominis. That happens a lot. And so if you see H. pylori, you should suspect there could be other bugs present as well. There's a study about that. Yeah, and here, look, you can see the positive H. pylori plus blastocystis, plus cryptosporidium, et cetera, et cetera. So anyways, there's a lot of work on this. And when you see H. pylori, you should just be suspicious there may be other problems as well. So commensal bacteria are where it's at. And we want to improve the commensal bacteria to reduce the problems with H. pylori with 2 simple things. People eat polyphenols and people eat fiber. Okay, so polyphenols, blueberries, cranberries, pomegranate, vegetables, fruits, and fiber from beans. People have high concentrations of polyphenols and fiber in their diet, then the commensal bacteria grow out, and then H. pylori becomes far less problematic, assuming you're not too stressed. This is the one that I think you see the most frequently, that is missed the most frequently in terms of downstream effects of H. pylori, which is that there's a problem with absorption of amino acids, even if the person's eating plenty of protein. And what happens when you don't have enough amino acids because you have H. pylori? Well, then you can't do something called protein synthesis. So that's going to affect your insulin. That's going to affect your enzymes. That's going to affect your antibodies. All those things are made from proteins, from amino acids forming into proteins. So if you have H. pylori and you don't have enough amino acids in your system because your stomach's not working right, you can have an antibody problem, an enzyme problem, a detox problem, a thyroid problem, an insulin problem, a hemoglobin problem, or a neurotransmitter problem, all because you don't have enough of these amino acids. All because you have H. pylori. That's why a lot of people come in anxious, depressed, and with sleep problems and fatigued with H. pylori because of this amino acid connection. There's storage proteins that you need to make, like hemoglobin. There's hormones that can be proteins, like insulin. That's a pretty important hormone. This is my favorite enzyme of all time, pyruvate dehydrogenase. We don't really have time to talk about it, but it's a cool enzyme, and it's made from amino acids. And of course, immunoglobulins. So if you're worried about that person's immune system and they don't have the amino acids they need to make immunoglobulins because they have H. pylori, boom, 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 you've got a whole problem there. How often do people have H. pylori? A third of cases can come from kissing, and that's kind of surprising. But I think most of the people that I've worked with, they get it through food. And we've tested a lot of families. You don't always pass it back and forth within the family. Oftentimes you'll have 1 or 2 family members out of 5 that have it, but you can get it in a variety of different ways, and it's a pretty common infection. If you have a minute later on, just type into your search engine, whatever one you use, H. pylori infection Nobel Prize, and this will pop up. There's a nice little description of the Nobel Prize that was given out for the doctors that discovered that H. pylori was the cause of ulcers in like 90% of people with ulcers. And it's a nice little thing to read, and the diagrams are nice to use. And I share that with patients a lot as just sort of a validation for H. pylori. And the one thing in the article too, like There's a summary that's like a 2 or 3 page summary of the Nobel Prize Committee's awarding of this. And when I read this years ago, there's this one part of it that just stuck in my mind. And it very clearly says there, and this is the Nobel Prize Committee writing this. This is not like, someone, a clerk at a health food store or something. This is a Nobel Prize. This is like the most important scientist in the world writing this. And it says there, not all, I'm kind of paraphrasing here, but not all patients with H. pylori experience GI symptoms. However, and it says it in black and white, every patient with H. pylori has inflammation from the infection. Nobel Prize Committee, every patient with H. pylori suffers from inflammation from the infection. And inflammation, as you know, is at the root of all these different health problems that we're always working on, whether it's fatigue or depression or anxiety or prediabetes. Inflammation is sort of a root cause for all kinds of different problems. So it's super important. There's all these different types of tests that you can do. I'm an advocate of doing, obviously, the GI effects test. That's sort of the one that I've worked the most on over the years. So a very good test to do. So you test for H. pylori first. Obviously, you have to run the lab. Then you want to eliminate the pathogen. After you've done the preparatory work, replace the bacteria that are missing, that are good ones, and get that all going. Okay. So anti-inflammatory diet, super important. And then eventually you're going to often need to treat other pathogens. As I mentioned, there can be parasites that are associated with this as well. The prescription that's usually used is something called a Prev pack. The herbs that are usually used, something called mastica. People also often use slippery elm, DGL, zinc carnosine, probiotics, GI repair powders. Every company will have protocols for treating H. pylori that you can get, and the antibiotics are commonly used. I think there's always a preference in integrative medicine, if it's possible, to do it without the antibiotics, to do that. If it's a really severe case and antibiotics are required, then prescribe away, but I don't know. Most of the time you can get it with the herbs, and it seems like a gentler approach. There may be times when it's just not appropriate, to use herbs because it takes too long, which is understandable. It takes longer. It's 2 months of herbs versus 2 weeks of antibiotics. So, you can go either way. I don't really have a bias on that. And then I had this summer a lot of years ago. I could tell you when it was actually. It was 2008, 2009. It was right around 2008. And it was the summer of children with H. pylori. I don't know why this happened in my practice, but throughout that one summer, I just had kid after kid after kid with H. pylori. 15-year-old guy, quarterback on his high school football team, wasn't able to do sports anymore. 12-year-old girl, diagnosed as having an eating disorder because she was vomiting all the time. It just went on and on and on. And these kids were unrelated to each other. And it wasn't like a one parent, I fixed one kid and then it was just completely unrelated people. And that just caught me. It just made me realize how many children suffer with this problem. And it's ridiculous. You do a stool test, you fix it, and they can move on with their lives. The food allergies go away, the fatigue goes away, they can do normal stuff in school again, they can exercise again. So you gotta screen kids for H. pylori because it's a super common problem. And we just see it all the time. I don't know why it's so common in kids. It's never diagnosed properly, I'll tell you that. These kids just suffer for years and years and years. So you'll often be the first person that brings it up, but you're just gonna tell your new patient, hey, we run this GI effects test on every new patient, and that will explain why you're doing the test. It's just part of my screening process. And you will pick up a lot of kids that have symptoms that in retrospect are obviously H. pylori, but that everyone else missed. Jesse is an old patient of mine. And this was a good one, so he was like a Division I college basketball player. He was like on a really good college basketball team. And then in the middle of, towards the end of college, he had to drop out because he just couldn't play anymore. He was just so exhausted all the time. And he ended up coming in to see me, and we worked together for quite a few years. And one of the things that really learned a lot from Jesse over those years was that we found H. pylori and treated it. And then he came back right after the treatment started and he said, I don't know what's going on, but my insomnia is gone. And I'm like, your insomnia? And he's like, yeah, well, you didn't tell me about that, Jesse. He's like, whatever. I don't he's like a 20-year-old kid. He didn't tell me all the stuff that was going on with him. He's like, yeah, you know what actually happened? I realized is that I was waking up every night with stomach pain, and my stomach pain is gone now, so I'm sleeping through the night. And I was like, oh, so we just like unintentionally cured your insomnia? He's like, yeah. And how do you feel? He said, I feel great. I'm sleeping through the night. No wonder why he was so tired. And that just woke up my eyes to woke up my brain and realized, whoa, okay, you never know what H. pylori is causing. Never, never, never. He also had major neurotransmitter problems, which we were able to correct. Pretty amazing what you can do with H. pylori. So treatment program, adrenal support, stress reduction, anti-inflammatory, digestive healing protocols for a couple of months first, then go after the H. pylori, either antibiotics or herbs, and then get that microbiome working right. It's like 3 steps. The more that you break this order, the more your results will not be so great. So can you get away with treating H. pylori first before you do the lifestyle? Yeah, but you're just going to reduce the number of times that this actually works. So why just take your time, do all the preparatory work first, and you'll be much more successful. And you don't want to have a treatment-resistant H. pylori on your hands. You really don't. So the adrenals, pretty straightforward. I have tons of classes and webinars we've done on that. Okay. Killing the bugs, again, it's either antibiotics or mastica, very straightforward. And then recolonization is polyphenols, fiber, good diet, stress reduction, all that kind of typical stuff that we do in functional medicine. One important thing, especially with H. pylori, is that when you're stressed, I mean, this is what Nobel Prize was about for H. pylori, right? They discovered that originally it was thought that ulcers were a stress condition, but then Marshall figured out, the doctor that got the Nobel Prize, that it was actually a stress-related condition that was caused by an infection by H. pylori in 80 or 90% of the cases. And so clearly when we're stressed, our SIG-A weakens, secretory IgA levels weaken, and H. pylori starts to flare up. So you could be healthy with normal SIG-A and a normal microbiome, and your body's just dealing with the H. pylori just fine. If you're stressed out of your mind, you become stressed out of your mind, you have a financial crisis, you go through a divorce, or something happens to your health, you go through a bunch of surgeries, then H. pylori can start to flare up because your immune system surveillance is weakened. That's why we start with the immune system correction, because that's the underlying problem in the first place. That's a really long slide. I'm going to skip this one. You can take a snapshot of it if you want and read it later. I don't know why I put that in there. Sorry. I do get a little into research. I must have thought this was a really cool study or something. All right, so review. And then I want to leave time to look at cases and then time to answer questions, okay? So H. pylori causes damage to the stomach lining, reduces stomach acid production, so amino acids are not properly absorbed. The chronic inflammation from H. pylori, Nobel Prize people said this, happens in everybody who's infected, okay? We don't want inflammation in the body. That combined with the low amino acid levels impacts every cell in your body because you need amino acids for protein synthesis. You reduce inflammation through diet and lifestyle changes first. You strengthen the SIG-A through the adrenal protocols. We're not doing those in this class, but in other classes you can take. I teach the adrenals quite a bit. And then you kill bugs found on the labs once you're really ready. And then at the end of all that, you recolonize with the healthy bacteria, okay? So just as a reminder, for those of you that joined us late, we are hosting and interpreting the Genova GIFX test plus protocols that work starting in July on the 11th. If you scan that QR code with your phone, you get $400 off, and you have to enter the secret code GDX24. GDX24 expires on the 7th of July. You will get an email with all this information if you don't have the ability to write it down right now because you're driving or something like that. Totally fine. The key thing to remember is starting July 11th, we have our lab interpretation class. And those classes include lectures that are pointed and short and focused on interpreting the labs, and live calls where you guys submit your own tests for us to review and design programs with. The whole point of the class is that you learn how to interpret these. So we want to do it in real time. So if you're interested in taking this class starting July 11th, run out right now, order your GIFX test, do the sample, samples, send them in, and you'll have the results back in time for us to look at them in class, okay? And we start to learn, you can start to learn how to interpret all this stuff. All right, so a couple of things. I'm gonna start off by doing one case, and then if you have questions, type them in, and we'll get to as many questions as possible. So let's look at a case here. I can't tell you how well this actually works. You know, like you will change people's lives if you test for H. pylori. It's like a $300 or $400 test. There's no reason to not do it. You know, you spend that much just buying new tires for your car. Okay, nice tires. You know, it's not a lot of money for people in our culture. GI effects test. Here's an example test. So they have this dashboard which gives you kind of the basic lay of the land, and it's a good place to start. So if you look at the far right-hand side, you can see infection as at a 10. So you're thinking, okay, there's an infection, not too hard. Now you just have to go find which infection it is. And then we look at the far left-hand side, you see where it says maldigestion. You're like, oh, well, that kind of makes sense. That's what Kalish said. You could have an infection that leads to maldigestion. And what does maldigestion lead to? Lack of amino acids. And what does that lead to? Problems with synthesis of proteins. Protein synthesis, you're not going to get very far in your life without being able to make proteins. So now we hunt through the test. I'm skipping a lot of it because we don't have that much time today to really get into this. But I should just mention the ones that are kind of, you can see here, pancreatic elastase, right up there. Okay, that's low, so you know that they're not, they don't have enough enzymes to break down their food properly. And then these are the commensal bacteria. We're not really talking about that for today, but I'll come back to it in a minute to show you something. And then you go down to this page where it says parasitology, and you can say this person has blastocystis hominis. Again, that's a parasite that's commonly associated with H. pylori. A lot of people have both infections at the same time. This person also has Dientamoeba fragilis. We had a case like this, just like this, in class this morning, in my mentorship class, D. fragilis. So getting rid of these parasites is equally important as it is to get rid of the H. pylori. And then this is the PCR where they're showing you what they detected and all the details on that. And then remember, you have to do H. pylori as an add-on. So you get your GI effects test kit, but you got to add on the H. pylori. And then there it is. Bingo. It's a life-changing result. Life-changing result for patients. And then once you get this far, so now you've interpreted the lab. You know they have two parasites and maldigestion and H. pylori. So we go back up to the top here for our GI effects. And you can't deal with everything at the same time. So we're just going to deal with the infections and the maldigestion as we set up the protocol here. I got a blank one. Here we go. Handy dandy. And in the class that we're promoting now, this one that you're all going to sign up for, this is all we do. The lectures are pre-recorded, so we get on the live calls and you guys are going to submit GI effects tests from your own practices or hopefully tests on yourself as well. And we just go over test after test after test after test. And once you've done 20 or 30 or 50 of them, it starts to sink in. That's the purpose of this interpreting class, is to interpret tests. So it's a ton of what we're doing right now. And just learn through repetition. You know, we graduated a new my mentorship class graduated this past June. So there were people that were with me for a year and then just finished. And I do all the exit interviews where I talk to them all. And I swear, like at least 3 or 4 of them, when I'm asking them, how did you do in the class? What did you learn? They're like, repetition. It was the theme for this June's graduating group. Repetition really is what helped. Repetition is what helped. You got to hear these things over and over again until you can really get them into your system and use them. All right, so now this particular patient, we have obviously H. pylori, but we also have 2 parasites. So what are you gonna do about that? Which one are you gonna treat first? Good question, isn't it? Then we have some problems with enzymes or maldigestion. And then what we didn't show you was the adrenal panel. So let's just put that in here, adrenals first. And adrenals is code word for lifestyle. So you do an adrenal protocol plus the lifestyle. That's what's going to happen first. But when you're ready, you get to your 2-month H. pylori program. And so this kind of question comes up a lot. What do you do when you have multiple infections? Always treat H. pylori first. That's how I was taught. You got to pick one lane. You could do the parasites first if you really want. And there's some, if you guys are prescribing medications, we had 3 cases in my practice in the last year and a half, 2 years, where they were all children, by the way, 14-year-old, 12-year-old, and then one that was a little bit older, like an older teen, where they had H. pylori and D. fragilis. These come in waves. I don't know why this happens. We had 3 in a row, and there is a medication I learned from the pediatricians we were working with. There's a single medication that'll knock out the H. pylori and the D. fragilis. So there's some times when you do prescriptions, is this kid going to take herbs for 4 months? Probably not. It'd be so hard for the parents to get a 10 or 12-year-old kid to take herbs every day for 4 months. So they have an antibiotic that knocks them both out. What the heck? So there's different ways that you can do this. I'm just showing you one example, which would be the mastica. And then you need to have, that's the killer. That's the one that kills stuff. But very specifically H. pylori. And then you need some support. So support could be in the form of DGL, could be in the form of zinc L-carnosine, could be in the form of slippery elm. Every company has, a stomach lining, gut lining support product, and you need that along with the mastica because you really want to get the inflammation down with a supportive product so the mastica can do its job. After the H. pylori treatment is done, then you would go on and do a parasite program. Or, as I mentioned, it could be that if you're using antibiotics, maybe you do a program that'll get them both at the same time. Let's just look at one more of these, and I'm going to go to questions. Let's see, another GI effects. Now, this patient has a 10 at dysbiosis, which is not a good thing, right? That's a bad dysbiosis. Infection is a little bit up there at a 6. So now you want to hunt around and find out what's actually going on here. And oh, here we go. So this person, no H. pylori, but blastocystis they found on PCR and on the OMP. So for those of you that, I'm assuming you must know this, but let me just mention. So microscopic OMP, this is the human being looking under a microscope to find stuff. And so when they did that portion of the test, they found Entamoeba hartmanni, Endolimex nana, and blasto. Okay, so again, that's a human being in a microscope. This portion of the test where it says PCR, strangely enough, that's a PCR test. I'm just kidding. So PCR, that's a DNA test, DNA-based testing technology. As we all know, since COVID happened, everyone's heard of PCR. And so the PCR didn't find those other bugs, but it found the blasto. PCR is complicated, right? Because they have these probes that they have to designate. So with an OMP, it's a human being looking, and whatever they see, they will report. With PCR, they have to pre-designate what they're looking for, and so they're not always going to correlate. Okay, but PCR is generally considered to be, very new, innovative, superior technology because finding the DNA of something is pretty straightforward. All right. And then a last thought before we go to questions, which is that I would highly encourage you all to always retest. If you find these bugs, make sure that you got them, Don't just kind of slack off and think that you got them because the person's feeling a little bit better, right? And before we do questions, I'll mention one last time, we have this workshop coming up, Interpreting GI Effects. It's a lab interpretation class. By the end of this, you'll have a pretty good grip on what you know and don't know. You can start to apply things to patients. All right, so I'm just going to pause for a moment, get a drink of water, and then we can talk about the questions. Let's see. Well, Natalie is with me at the fax machine. I don't think we give out my slides, so that's a no. Um, let's see. Oh, Susan, good question. How often is unintended weight loss associated with H. pylori? Super common. I see that all the time. That was the kid I was talking about, 14-year-old kid, totally underweight. It happens a lot. You know, especially if you're going through puberty, like there's not a time to not have protein synthesis happening, you know? Not at all. It's dangerous for kids, super dangerous. Um, so they see, what about Lyme? That's a totally independent variable, you know, totally independent. But you know, infections are cumulative. So, and I think it's reasonable. I set a very low bar for myself when I was in my 30s. I remember doing this. I remember going to work one day and thinking, you know what? I want all my patients to be infection free. And I thought, okay, that's a reasonable, you know, thing. And honestly, part of it was that I just didn't want people coming in my clinic with giardia and going to the bathroom. I didn't want to get sick, you know. It was very self-centered in my early 30s. But now that I think about it, no, it's a reasonable thing. You should have all your patients should be infection free. And the only way you're going to know that is if you do the testing, because you can't tell just looking at somebody. Um, can you do kill or remove phase while breast? So not doing it during pregnancy and after breastfeeding is done. You might consult with like an expert in these herbs that would know more than me, but that's always been my attitude. Um, you can test the oral microbiome. I'm not an expert in that, but that's a growing and interesting area, you know. One round of treatment kills the H. pylori most of the time if you've done the prep work. So again, that Mayo Clinic study, 8 out of 9 times we got rid of the H. pylori, but we did 2 or 3 months of lifestyle preparation first. The shorter that the lifestyle preparation is, the less likely you're going to get rid of it on the first time. And it ends up saving the patient money, saving the patient time if you just do the lifestyle part for the first couple months and then kill it. Cutting right over to treating the GI right away, it's just going to cost the patient more time and more money um, to rush, you know, just not helpful. Um, oh yeah, so who did we not get better? You know, this is really interesting. And someday I want to do a whole class on that Mayo Clinic study because it was really fascinating. So we had 25 women in high pressure executive jobs. Originally, we were going to pick 25 nurses at the Mayo Clinic because it's a pretty stressful place to work. And I kind of fell through and got to be too complicated for all the permissions and stuff. So we picked 25 women in Silicon Valley in executive positions, you know, who were just stressed out of their minds, running huge companies, stuff like that, you know, lawyers, all kinds of people like that. And so the two people that we at 2 out of 25, a couple dropped out, but you know, this said maybe 23 were left or something. The two people that we really completely failed on, meaning that not to do with H. pylori, but just to do with their adrenals getting better, was one of them went through a divorce during the study. It was a 6-month program. So she started her divorce during the study and was going through, and she got worse. Okay, well, understandable because she was stressed out of her mind. And then the other one that got worse had her father and her grandfather were both hospitalized during the 6-month study. She would do her whole job, working mom, had like 2 or 3 kids, do the family thing, do the job thing, and then at night she would go visit her dad and then go to a different hospital and visit her grandfather, both of whom were dying in the hospital. That woman didn't do very well either. So lesson learned, if you're under a huge amount of stress, it's hard to get people better until, in terms of H. pylori, in terms of gut treatments in general, until that stress has been reduced. But for the divorced woman, I'm sure after the divorce, we could have gotten her better. For the woman looking after her dying dad and dying grandfather, I'm sure after they had passed away and she'd processed all that, you know, we could have gotten her better. But just a lesson in how stress, you know, really regulates our health. Um, let's see here. I'm just going through the questions. I'm not able to get them all. Yeah, so cognitive decline in Alzheimer's is strongly related to inflammation. Prediabetes and diabetes is strongly related to inflammation. Autoimmune disease is strongly related to inflammation. So all of these conditions, you're not going to treat Alzheimer's with this, you're not going to treat diabetes with this, but you're reducing the inflammation, which is part of an overall program to get that person to be healthy. That's really the goal. If someone has H. pylori and B. hominis, this is Susan again. Susan's asking a good question. Susan, you should sign up for my class. Susan, you should sign up for the mentorship, probably. These are good questions. Will the H. pylori take care of the B. hominis? Not even a little bit. That's a good question. Mastica only targets H. pylori. It's not going to do anything against yeast. It's not going to do anything against parasites. Mastica is H. pylori focused. That's an important question. So you have to do a completely different treatment for the parasites or for yeast overgrowth. Okay. Yeah, we're going to send out the recording for sure. Let's see. It's very common for the standard medical testing for H. pylori to miss it. Endoscopic exams miss it frequently. Blood tests miss it frequently. The breath test misses it frequently. When I first started doing H. pylori testing, we were also running blood antibodies. A lot of people are getting endoscopic exams. We're doing these whole complete workups. And the most reliable marker by far was the stool testing. Okay. So I would treat, well, whether you, this is Glenn's question, whether you're going to treat H. pylori, really, I don't think it depends as much on the lab. I mean, if the lab is positive, then you have the possibility of doing it. Then after that, I would just look at the patient's symptoms and see, does it make sense, and their microbiome, does it make sense? So it all has to add up. And then Kristen says, I'm seeing a lot of H. pylori post-pandemic. Yeah, very resistant to everything that's worked in the past. Yeah, I know what you mean. So that's just a bummer. All right. Well, so for Kristen, since the pandemic, certain of our patients have huge amounts of inflammation that's related to having had COVID. Maybe it's not long COVID or long haul COVID, but it's still there, got some inflammation from the viral infection. So if you're going to get success with treating H. pylori, you got to deal with that part first. Okay. You have to do the, kind of post-viral follow-up stuff and get all that inflammation. Then you go after the H. pylori. It's a good question. It's a big problem now in general. So long-term effect of antibiotics on the microbiome, yeah, that's always a bad thing, but you got to assess, is the damage that's happening from the infection worth a course of antibiotics? And antibiotics have their place, if they're used properly. So the retesting, Gail is asking, the retesting happens, you treat however you're treating, medications, herbs, whatever you're doing, then wait 2 months after the treatment's completed to give the H. pylori a chance to come back, and then you retest. Is a GI stool test enough? Yeah, I mean, I found the most accurate is with the GI testing. So you're welcome to do other testing. I think the more testing, the better. But if you want a single test, I think the GI testing is really the best. Let's see. Do you have a favorite herbal protocol? For sure, the Mastica. Absolutely. Food plan. I don't know. I don't think it matters that much. Just don't eat raw chicken or raw eggs. I don't think this is so tied into. I mean, obviously, you want an anti-inflammatory diet. That's kind of a no-brainer, I don't think it's related to contraceptives in any ways, other than and then the contraceptives can throw off your gut, but I don't think that's going to make the H. pylori a lot worse. Not what I've seen. You don't have to use the biofilm disruptors. I'm not anti-biofilm disruptor, but I'm like kind of anti-biofilm disruptor a little bit. Why? Because it's just so many supplements for people to take. Usually they're on so much stuff already that I don't feel like I can squeeze in one more thing. You're welcome to use them if you can get people to take them. Let's see. Christina's asking, do you recommend this treatment order in acute H. pylori? Well, if it's acute, it's a completely different thing. All we're talking about today is chronic. Yeah. If it's acute, then it's a completely different situation. Then you just treat it immediately. Well, so everything we're talking about today is for chronic infections because that's mostly what we're dealing with. And so any chance I get to treat H. pylori, I will treat it, just so you know. Maybe I'm a little gung-ho on that. Some people would probably say, oh, why are you treating it? And if there's any indication in the lab that it's present, I'll go for it. Yeah, and I don't think you need to pair it with a breath test necessarily. Um, let's see, I think we're going to run out of time. One more, maybe I can do one or two more questions here. These are good questions you guys have, though. Let's see, Glenn. Yeah, I mean, Glenn's asking the central question, so I'm going to end on this question. Thank you, Glenn. So the question is like, how do you decide between antibiotics and herbs? So I'll give you examples. I used to work with this hockey team, professional hockey players in the United States, a long time ago. And what I learned was that it's pretty hard to get professional hockey players in the middle of hockey season to take Mastica for 2 months. I remember one of the guys saying, look, if someone even sees that stuff in my locker, in the locker room, I'm going to get my ass kicked. Like, I'm not going to take this stuff. So all the hockey players took the antibiotics. Apparently, that's more manly, and that worked out for them. Another example, a woman who wants to get pregnant like yesterday, and so 2 months of herbs, I have to wait. Yeah, I can't get pregnant while you're doing this. Okay, so for fertility cases, maybe the antibiotics make more sense, as long as you do all the microbiome repair. I've had patients where her dad was a pharmacist and she just wanted to do antibiotics. I'm like, that's fine, if your personal preference is in that direction. I try to give people the best advice I can, which is based on the severity of the symptoms. And in the milder cases, I think the antibiotics are completely inappropriate. Um, but if someone's, nauseous and vomiting every day for the last 5 years, I think it's okay if you're going to go through a week or two of antibiotics, and then we'll do all the repair that we need to after that. So if there's time constraints or there's personal preferences, I've worked with a lot of natural health yoga teacher type people who just absolutely are against taking antibiotics. The herbs work really, really well if you know what you're doing. You just have to get the dosages high enough. I'm not allowed to tell you what the actual protocols are. You have to sign up for one of our classes to do that, and that's more for your safety than for mine. Okay. Um, but you don't want to just charge in and do that if you don't, have somebody who's following you and helping you do all that. Okay. Um, let's see. So, oh, this is a question, Lisa. Why didn't inflammation show up on the case study when you said every patient suffering from H. pylori shows up with inflammation? But how's that inflammation manifesting? That inflammation is not always going to be not always going to be an inflammatory marker per se. Okay, that's the problem. That's why it's missed so much. So inflammation can be super subtle. It can manifest in a whole variety of different ways. That's a really good question. So, and let me say that again. H. pylori always causes inflammation, but it's not always going to raise the inflammatory markers that we're so used to seeing. It's not always going to be the case. All right. Oh my gosh, I have to stop. There's so many good questions. I didn't even cover like 10% of the questions here. Okay, I got to wrap it up now. Take care, you guys. We'll send you copies out of the recording and look forward to the next one of these when we can talk again. All right, bye for now.